Good afternoon. I'm George Latimer, Westchester County Executive. This is our daily briefing of the impacts of the COVID-19 outbreak here in Westchester County. We've heard Governor Cuomo give his daily address earlier in the day, and he has the state testing statistics that matter across the state. 30,811 New York State total positive tests. Here in Westchester, the number as of today is 4,691 positive tests. Westchester continues to have the greatest per capita testing for COVID-19 of any county in the United States of America. We've tested a higher percentage of people. We have at least 3 sites that are up and operative through a number of different areas, and so we are testing more people and therefore showing more positive results. As was true with the New Rochelle hotspot that began our activities 3 weeks ago, we are not the worst, but we are the first. And I think whether it's New Rochelle as a municipality, Westchester County as a county, or New York State as a state, we've taken our responsibilities to test and to identify the spread of the contagion most aggressively. And so in the short term, it looks as if we are the sole source of the contagion, when in fact we're finding out that this virus is going all across the United States of America, and in fact has already been in the process of going all across the world. Our statistics today, they do lag the state numbers by a few days, but at this point in Westchester County, amongst our municipalities, it generally follows population numbers. New Rochelle has the highest number of cases with 234 positive cases. That's a slight uptick over yesterday. Yonkers has reached 201 cases. The town of Greenburgh, which includes both the unincorporated part of Greenburgh and the 6 villages that comprise Greenburgh, now have 124 cases of COVID-19. The unincorporated portion of Greenburgh has 63 cases. The 6 villages in the aggregate, 61 cases. That's followed in sequence by Mount Vernon with 89 cases, White Plains with 74. Eastchester comes in next, 38 cases in the unincorporated portion of Eastchester, and adding the 2 villages, which have 16 cases, a total of 54 cases. The village of Portchester has 51 cases. The village of Ossining has 47 cases. Scarsdale has 39 cases, and Mount Pleasant 32 cases. We have a full list of all municipalities, which we're releasing to the press, and various publications will determine how to use that, but these numbers are open for general scrutiny by anyone. They are broken down by municipality, by incorporated cities, villages, towns, or the unincorporated sections of towns. However, the aggregate number is about a 2 to 3 day lag over the state numbers. The state issues numbers directly from testing, but in between they have to inform individuals whether or not they have tested positive. Once that's been done, then they release the information to the county. We're able to tabulate it, but usually that information process takes a few days. But our numbers at least are generally accurate, and they're certainly the numbers that are before our emergency services people. So if a fire department, if a EMS or a police department has to respond to a site, they would have the information correlating to the numbers that we've shared with you today. Our briefing today is going to be a little quicker, and we're going to try to touch on some very specific points, and we certainly will follow up on any questions that are had. When we're finished with this, we'll take questions from the press, which are coming in remotely through technology. We have done it this way so that the members of the press are safe from the possible contagion that could come from amongst ourselves and each other. And so they are connected remotely to us, but they're able to ask any questions. And we certainly will do any follow-up interviews with any member of the press that would like to talk to us directly. Our Westchester County Economic Development Team is researching the various loans and grants programs for small businesses. We know they have been devastated by this. I myself have a background in corporate life, as does Bridget Gibbons, who is our Director of Economic Development. She's a former small business owner, as well as a person who's worked inside a larger corporate structure. She's leading our charge on this. You can get more information from westchestercatalyst.com, and there's a /coronavirus updates. But most importantly, we did have earlier today a Facebook discussion with Bridget, and she talked about some of these different issues on the economic development scene. We are looking to see the actual impact of the federal legislation that has passed, that has set aside categories of resources for different types of impacted businesses, individuals, certain industries, and so forth. It is too soon for us as a county government to analyze what the impacts are for Westchester County or for Westchester County businesses. But next week, Bridget will be conducting 2 virtual conversations, and we'll invite business folks to tune into those 2. And she will be working with Deb Novick and Sherry Asher and the rest of our economic development team. For those folks out there who want to either donate or sell personal protection equipment, PPEs, which is an acronym that we've all just learned in the last few weeks, there is an email address, icanhelp@westchestergov.com. It's just as it would sound, ICANHELP @westchestergov.com. We've had a lot of individuals who've reached out to us and have indicated that they have a source of production of PPEs, whether it's masks, gloves, gowns, whatever those things are. We will need it, and a host of different service providers will need it. Local police, local fire, local EMS, healthcare workers, any people that come in contact with the community at large, those who work with children. There's a host of different entities that would like to have some version of PPEs available to them. And for those who can supply that, either for profit or for donation purposes, they can reach us through that website, and we will try to make the connections necessary. We have made an ask of the municipalities of Westchester County, and they've been very quick to assist with us. We want to identify every senior citizen subsidized housing unit in Westchester County. They usually are in apartment buildings that were constructed, many of them in the 1970s and 80s, through some of the federal programs. There have been a few more recent. We want to make sure that whenever a resident of those buildings tests positive for COVID-19, that the business leaders of that building, the people who manage that building, are informed as well. That protocol is in place for nursing homes and assisted living facilities, but it may not be in place for those buildings where seniors move into to have a discounted rent and are able to afford living there. We want to be sure that if there is a case of COVID in any of these buildings, that the building management knows, the employees of the building know, so that they can protect themselves when they deal with those residents and then as they deal with other residents in the building. We've seen in Kirkland, Washington, what happens when the virus becomes rampant in a building where there are seniors and those who have compromised health, usually later in years, and we want to make sure we avoid that. So we've asked the communities to do that. They've been more than willing to do that. We hope to have those all together by today and follow that up with state enforcement and state notification on these things. Westchester County Department of Community Mental Health, along with partner agencies, is offering guidance and support for all of us as we're dealing with the mental health impacts of the coronavirus, COVID-19. There's a host of different areas where our community mental health department will interact with different organizations to provide support and referral, behavioral health crisis prevention and response teams, working with targeted groups. Tomorrow we will have a Facebook conversation with Michael Orth. We had one last week. We'll have another one this week, which will outline some of these programs, and hopefully those programs will be of help to those people who are suffering through, as we all are, the emotional reactions to watching both the virus spread, the threat of a health calamity, and also the economic impacts of what we're facing. We've discussed already that we have a 211 hotline that we're working on with the United Way to provide answers. The hotline is heavily used, and it becomes very difficult for people to get answers in real time. We have set up an email address. I mentioned it yesterday. You can find this information on the Westchester County government website, but if you want to just jot it down now, it's COVID-19 FAQ at westchestergov.com. COVID-19 FAQ, frequently asked questions, at westchestergov.com. And there's a function for you to be able to ask questions and hopefully get answers back when those answers are generic. When they're more specific, we have other hotlines and other ways of contact. We'll repeat what we said yesterday and the day before, which is if you suspect that you may have the symptoms of COVID, call your family doctor. Talk to your doctor. They're the ones that know you best. They're able to give you advice to assess your symptoms and to be able to go forward. Do not go to the emergency room. Do not go to your doctor's office. Do not go to urgent care. Speak to your doctor. If you do go and you have the infection, you will give that infection to other people who are waiting to see their doctors, and that will only make matters worse. There is a New York State hotline for testing requests. It's very difficult. It's a long backup line, and many people have talked about the difficulties of getting through. That number is 888-364-3065. Everyone is doing their best to try to respond in real time, but there are difficulties in being able to get through all of these things. We want to repeat the personal plea that we made in the last few days for nurses, doctors, other healthcare professionals. If you have the talent and the ability to help us out, we are trying to be ready for a surge when it arises. We have every reason to believe, based on what's happening overseas, that it will come here as well. And when it does, we'll need not only beds, but we're also going to need trained professionals to be able to help us. And some of the trained professionals we have now are performing certain functions which are not directly patient-related. We can supplement those positions with people who are coming back to give us a helping hand, and then release the current nurses and doctors to be able to deal in greater percentage with those people that are ill. To this point, we've gotten 122 volunteers to call in, 90 nurses, 12 doctors, 20 other people. We're very grateful for the folks that have reached out to us, and we hope that we'll make good use of their volunteer effort. Lindsay Jackson in the county government is the coordinator for the information, LAJC at westchestergov.com. That will help. Information on our website relating to coronavirus, of course, is posted in English, but it has also been posted in Spanish. We're in the process of posting it in Chinese as well. We'll use any other languages in order to reach those who are more comfortable in a native language. Je parle français, je parle un peu. And for anyone who speaks French, we'll put it in French as well so that people will have that information. The purpose is not to move away from our native language, which is English, but to provide important information at a critical time so that people understand it. And we want them to understand it in whatever way they can understand it so that they can act prudently off of that information. We also would like to point out that we mentioned already that the Westchester County Center is being fitted by the State Department of Health to provide us with additional hospital beds. The hospitals of Westchester County in the aggregate have slightly over 3,000 beds. They have been tasked, as all hospitals have in New York State, by Governor Cuomo to add at least 50% more beds in their hospitals. Now, as they seek to do that, we hope that they can add to that inventory another 1,500 beds, which would get us to 4,500 beds in an ideal situation. Whether that is or isn't possible is between the state and the various hospitals, but the county center then becomes the overflow beyond that inventory. And obviously, as we do the math, as we reach the point of 5,000 cases in Westchester County, we know that 20% of the cases will require hospitalization, and of that 20% of the cases, a quarter of those will require ICU level of concern and level of care. So we're going to see exactly how the state health department wants to divvy up that. We have, as county government, identified additional space that can be used for hospital purposes beyond that space that's provided by the county center. We will discuss that with the state. Obviously, folks who have suggestions are welcome to send them to us. We have reviewed many of the standard places. Folks have asked us about United Hospital in Portchester. We've determined with the building department that that building is not suitable for occupation. We wish it were, because it had functioned as a hospital, but it cannot be used in its current physical condition. There are other sites that people have suggested. We appreciate any advice. If we've already identified it, we'll let you know that when you make the inquiry. One final point in all of this to mention, we're trying to keep today's briefing, reasonably short and direct. There is a concern, I think, that people have that I've seen this in the national dialogue, that this now is a New York-centered disease, New York metropolitan area-centered disease. And I would tell you that we saw the same dialogue about 3 weeks ago as related to the city of New Rochelle. People identified that there was a high concentration in New Rochelle, and somehow there was a tie into the geography itself to the disease. Now that we've tested more thoroughly around Westchester County, what have we found? We found that the higher results follow higher population. As Yonkers, New Rochelle, Mount Vernon, White Plains, and Greenburgh, the 5 largest population centers in our county, are now the 5 largest places where we have positive cases. So it is not that there's a unique hotspot in any one place. It was that we tested aggressively in New Rochelle, and we found a lot of those cases initially. The numbers of growth in New Rochelle have slowed compared to other communities around Westchester. Why does that matter beyond the borders of Westchester County? Because now New York is facing the same argument in the nation. Someone will say that one of the smaller states out west or one of the larger states in the south has only 50 cases in the whole state, or only 35 cases in the whole state. And they point to New York State as having this high number of cases now, as we mentioned, over 30,000 cases. I have no way to know this, but my experience in Westchester County, projected nationally, tells me this. The more you test, the more you find positive cases as well as negative cases. It is the failure to test in the vast majority of this country that is the difference as to why New York has very high numbers and other places have very low numbers. The minute you start to test aggressively, you will find more cases. And I can't speak for specific states, but those states that are reporting very small numbers have not tested their population sufficiently to really know if the contagion is there. Why do you need to know that? The numbers may be comforting to you right now if you live in a state and it's a very small number of positive cases. The virus didn't come here. We only have 25 reported cases in the state or 100 reported cases in the state. But when the surge comes, when the number of people that are infected, whether you've identified them through testing or not, when they get sick about 3 weeks into their contagion, and it'll only be 20%, 80% of the folks will be fine and they won't be affected. But when that 20% cohort of your population gets seriously sick, you will be unprepared to deal with what happens. You will find yourself in an Italy-like situation where the community hospitals that you have that normally can handle the normal flow of health will be overrun. And if you haven't anticipated that there is a higher percentage of cases in your jurisdiction, you just don't know about it, you're not going to have the extra beds ready. You're not going to have the extra PPEs or the extra ventilators ready for you. New York and the neighboring states around us, Connecticut and New Jersey, we have taken this seriously. We understand that we are in a situation where if we want to protect our people, we have to plan for the worst case scenario. I would be the happiest person that I know if this does not materialize at the level that we fear. If it turns out not to be a problem, if we're able excuse me, to reopen stores sooner than we anticipated, go back to religious services sooner than we anticipated, that would be a terrific outcome. But what if it's not? What if what has happened in every other country happens here as well? What happens if what we saw in Italy happens here in New York? And worse, other parts of the country that don't think they have a problem. That is why we're taking these extraordinary steps. That is why the leadership of Governor Cuomo has been essential. That's why with every town supervisor and every village mayor and city mayor that I've interacted with, I have seen people, and it's Republican, Democrat, brand new elected official, long-term elected official, we're all responding with urgency because our job is to protect people's lives. Our job is also to deal with the economic downturn that we're facing. It's serious. We admit that. We understand that. The efforts we're making alongside the federal effort, we hope will help. And we're thinking about how to pull ourselves out of a recession or a depression every day of the week. But if we reopen prematurely, we will spread the virus further, and more people will die. And if you want something that's bad for business, death is bad for business. Mass death is bad for business. It will send a message that will have a chilling effect on the stock market. It'll have a chilling effect on people's willingness to invest. It will have a chilling effect on the way that people look around them and determine that they were deemed as, expendable by their next door neighbor because their next door neighbor was one age and you're a different age. We cannot play that game. And knowing that we need an economic rebound, it comes when we have put this virus behind us. If it can be put behind us in the short term, that would be wonderful. But in the meantime, we have to make prudent decisions based on what we see around the world. And it's not behind them in Italy. It may be behind them in China to some extent now, but China has a different society. China locks down their society because they have a totalitarian form of government. We do not. We have freedom, and we build that freedom into reality. Until and unless we lock down the United States of America, it has to be a clear and present danger for every American to accept that. And that is what we face. And what we face as a county government is to try to do the very best we can to defeat this disease, and then do the very best we can to pull ourselves out of the economic mess that we'll find ourselves in. But we do not do ourselves any good by not following the science. We do not do ourselves any good by telling ourselves fairy tales, that somehow magical fairy dust will save us. Science will save us. Practical decision-making will save us. Discipline and to some degree self-denial will save us. And we will come through this effectively. And we will go forward as one of the greatest counties in the greatest state in the greatest land in the history known to man. I'm going to open it up to questions, take whatever the press has asked.
Okay, the first question comes from NBC. It comes from Linda. She wants to know, doing a story on supermarkets, are there specific regulations on what supermarkets are required to do to prevent spread, or is it a matter of providing suggested guidelines? If it's suggested guidelines, is there an agency people can contact if they want to express concern about a particular supermarket? Who should they reach out to?
The state has determined that supermarkets and other food entities are an essential service, so therefore they have not been shut down and they have not been made subject to the staff reduction quotas that have gone to other businesses. The state health department has set out certain protocols for how supermarkets are to be operated and the protections and cares that are necessary. In individual supermarkets, we've had dialogue informally with many of the major and some of the smaller chains. I must tell you that some of them have responded brilliantly. Stu Leonard's, the DeChico markets have done really excellent work in trying to update and alert both their staff and their customers to the best practices to make sure there's social distancing to the best extent possible. It's a little difficult to walk through the store and tell people verbally push back, move away, do certain things. So we try to make those emphasis in general. The health department, county health department, is tasked with implementing state health department rules. We will do our best to help enforce those rules. Our Consumer Protection Office is part of that process, along with the health department, although I must be candid with you. Most of our health department personnel are deployed to deal with the core of the contagion rather than some of the ancillary things such as this. So we will make a renewed effort to talk to those who manage supermarkets and, for that matter, any facility, that we try to make sure social distancing occurs and at the same time not go as far as yet has been done in other countries, which is to shut down hours of access and so forth. But the leaders of our state certainly will make those decisions for a statewide basis or in concert with neighboring states if this contagion continues to become more severe.
Okay. The next question comes from Tara Rosenblum from News 12. I'm paraphrasing, but essentially she is asking, seeing the number of people that have been frequenting the Kisco Dam and other parks, will you shut down the Kisco Dam and golf courses in Westchester, seeing as though people seem to not be social distancing?
We're not going to shut down the park system in Westchester County at this time. If circumstances require that later on, we will. We have the same challenge. The governor spoke about it in terms of New York City. We have that same challenge. We had a very warm weekend, and a number of days are disproportionately warmer, so we've had more people out. Right now, we have shut down all forms of entertainment. No movie theaters, no bowling alleys, no organized sports and recreation. So we still have the park system, which allows for passive or light active recreation that's still there. And we think that's an important outlet for people. If we reach the point in the heart of the contagion where we have to shut the parks down so there's no contact between people, then we will do that. But at this point, as long as people keep social distancing, as we are told, it is still acceptable to operate that way. We have our bike trails available for people to walk. Now, a couple may walk together, or a trio of friends may walk together, and they have to show intelligent social distancing. If you're bicycling, you generally bicycle by yourself, but if you're bicycling with a group of other people, show social distancing. We've had more than one concern about the golf courses. I've addressed this before. I know this works against a general feeling about the sport of golf. I am not a golfer. I don't play it, and I don't play it well whenever I've tried to play it. But golf is not a contact sport. If we had touch football, rugby, ice hockey happening on a county park, those are direct contact sports where the performers are in each other's personal space in order to play the game properly. Golf is an individual sport. You shoot, you hit the ball and score, and the other person who's playing with you does the same thing, but you do it separately. You don't touch each other. In order for that to happen safely, the following things have to happen. You have to socially distance yourself when you're teeing off. You have to socially distance yourself on the green. More often than not, when you're in the middle of the fairway, you're not close to each other because we all hit the balls in different places. I generally find myself in the rough the handful of times I've played. In the county park system, where we have our 6 county golf courses, we have a rule of 1 person per golf cart. so that it's not 2 or 3 or 4 people in a golf cart. When you look at a private club that may be closed, the private club is closed not because the act of golfing deserves to be closed, but because we're closing the clubhouses. We're closing the 19th hole, which is the bar. That is where profit is made in a private golf club. I know this because this is part of what I was responsible for in my corporate years for resort properties that had golf as a component to it. So the private clubs realize that they can't make the money, they can't pay the staff, so they shut down the golf course. The public golf courses are closed in the golf store. They're closed in the restaurants where people congregate. But people play golf individually in threesomes or foursomes. And for that matter, the weather was a little bit warmer, so you had more people playing golf more recently. If the weather takes a bite to the cold, there'll be less people out on the golf course. We are not in the heart of the golfing season by any means, but those people who love to play golf do play more frequently. But as much as it seems, well, golf is an elite sport, only a certain level of person plays golf, it's not a sport, for the masses, that may be true, but the sport intrinsically does not involve the kind of close and personal contact that would spread the contagion. That is the decision we make about whether we open or close a facility, whether or not it advances the spread of the contagion. And we believe that people do need recreation. Right now, they're in their homes, they're not working, they're not doing other things. They should be able to go outside. That is what our park system is for, as long as you do it intelligently and appropriately. If circumstances require us to close it in the future, because we see a greater concern about this, and certainly the governor will do that at the higher level down, then we will close it. But the pushback that people have when they see folks on a golf course, I think, does not reflect the nature of the sport itself.
Okay. Next question comes from the Wall Street Journal. Is there any evidence that the containment zone and other restrictions, quarantines, have slowed the rate of infection or hospitalization in Westchester? Yes, if you could explain why or why not with great detail.
This sounds like one of those essay questions that will be 50% of my grade in this class. The containment zone, which was established a couple of weeks ago, was in a 1-mile area that included a fair piece of the northern portion of New Rochelle and also clipped into part of unincorporated Eastchester that affected the Tuckahoe School District. It had the practical effect of shutting in its entirety the Tuckahoe School District, and it shut 3 of the buildings of the New Rochelle School District. Within a week's period of time, all school districts in Westchester County were closed. Part of the concern was that the concentration of people who lived in the area, if they interacted with each other under normal circumstances, would spread the contagion at a higher level. What the containment zone concept did was to close major group gatherings in that area. The churches and the synagogues of that area were shut down. There were 2 country clubs that were shut down, and the schools that I've just mentioned. Those are the major things that were shut down in that area. Now, of course, all the restaurants have been closed since last week, and other facilities that were open at the time of the containment zone have been shut down subsequently. We have seen a slower rise in the number of New Rochelle numbers than we have seen in other communities. When we did the numbers 2 weeks ago, New Rochelle was in the 100 range of cases, well above every other community in Westchester County. Now we're seeing that because of the population base, as we're testing more thoroughly in Yonkers, in Mount Vernon, and White Plains, those numbers are starting to narrow. New Rochelle and Yonkers both now have over 200 cases. When New Rochelle broke 100 cases, there wasn't even a case in Yonkers. So I would argue that the zone was helpful in the process. What I also think is helpful is that you test across the board geographically. We focused on New Rochelle at the outset because we knew we had a contagious situation with the index patient, and we needed to see just how far and wide his circle of contacts wound up infecting. And that was a very important thing for us to understand, so we saw what the spread looked like and how we could control it. But I think it's had a positive effect. But what's happened since then is, rather than having a zone of containment by closing things, we have now closed across the board. Statewide, many of the things that were closed in the containment zone. All the schools are closed, all the restaurants, all the bars, all the health clubs, all the gyms, all the bowling alleys, all the theaters, all the beauty salons, all the nail salons, all of the barbershops, all of those things are closed, whether they're in the zone or not. And I think you've seen a slowing of social contact. It's frustrating. It's created this economic crisis that we certainly face, but it has also slowed the rate of growth in New Rochelle, which is where it was applied. And I think what it has done also is it's given us an indicator of what's happening in the nation. People talked about New Rochelle as being the source of this contagion when no one else had anywhere near numbers. One of the tabloids had a very unkind front page where they played on the name, and they thought that that was, a way to attract attention. Now what happens? Now it's New York State that is forced in the same kind of situation. It is New York State that is viewed as somehow as a pariah because we have all these cases, when in fact, New York State has taken the lead in what every state should do. We've tested aggressively. We've made aggressive contingency plans for what would happen when the surge hits. And we say when the surge hits because it's hit everywhere else. We've seen it in time after time. It's happened it's happening in Spain as we speak, and it still hasn't receded in Italy yet. So I think what New York State has done is prudent, and what's happened in New Rochelle, it was not the worst, it was just the first. What's happened in New York State is it may not be the worst per capita, but it's the first. And my message would be more broadly, as we have tested all over Westchester County, we have more testing to do. We're behind in testing, but we're still ahead of most everybody else. Test your residents in these other states. It's not for me to tell Nebraska what to do, or Wyoming what to do, or Texas what to do, but if you fail to test and see the degree of contagion, it does not mean that you don't have positive cases. It means you don't know if you have positive cases. And I would finally say that it's the same way as driving your car with a broken gas gauge. You don't know how much gas is in the car. You don't know when you're going to run out of gas. It could happen at any point in time. So you're flying blind, and you should know these things in order to deal with them effectively.
Okay. Next question comes from Marcus Solis at WABC. In regards to New Rochelle residents still under quarantine despite being asymptomatic, what is the recommendation for people living in the containment zone? Today is technically the last day of the containment zone. Does anything change? Does the National Guard stay? One resident we spoke to says it's hard for them to get some services like plumbers and electricians because they're scared to come to New Rochelle. What is the message to them?
Well, first of all, we're following the state protocols on when an individual can be released from quarantine. And if the state indicates that there's a test process that happens at the end of a person testing positive or being under quarantine, that is what we are following. I understand there may be some different rules in New York City, and under what basis they establish that, I don't know, but we are following the state rules, and those state rules will identify what that testing period is before we release. We know of a number of individuals in Westchester County who have gone through the 2-week period of time, having tested positive, having been in isolation, having shown no symptoms at the end of their 14 days, and have been taken off the list of positive cases. We believe that those individuals have beaten the virus, so to speak. I would assume those rules apply to New Rochelle as they do to everywhere else, but we are following the state rules, not another set of rules. They're not a Westchester set of rules. We're following the state protocol in these situations. In terms of, the focus on New Rochelle, I think really needs to be restructured now. Wherever there is a positive case anywhere in this county, we have almost 5,000 cases, 4,700 cases. This applies now everywhere, not just in New Rochelle. And we're having double-digit results everywhere you look now. Yorktown has 30 cases. Mount Pleasant has 32 cases. Town of Eastchester has in the 30 number of cases. It's the same thing for everyone, not just New Rochelle. There has to be a period of time in which they go. When they reach that end of period of time, they have to be assessed, and they have to be assessed as virus-free or having defeated the virus in their system, and then they can move on. And we're going to follow the state requirements, and our state health department will implement what those state requirements are.
Okay, the next question comes from Peter Katz from the Westchester Business Journal. Senator Schumer says Westchester County will receive $168 million from the Senate's $2 trillion economic bill. Is that enough? Any estimate on how much COVID-19 has cost or will cost the county?
Well, we'll take it, first of all, and we will use it to help for the direct use of the county. We'll use it to make sure that we're providing all of the different services we need to protect lives. Us dealing with the Westchester County Center and turning it over to the state, ditto the Glen Island parking lot. There are some costs involved in that. We hope those reimburse us for those costs, but we're more concerned about making sure that we keep our public health services nurses on duty, that we keep our police officers on duty, and that's going to be critical for that. I've said about a week ago, and it's even more true today, that our finances, and I suspect the state's finances, are in a free fall. You cannot start the process of figuring out how are you going to dig out of this. What's our projected sales tax revenue. How do you know what your revenue is going to be until you know when the stores are going to reopen? You can do a model based on, oh, they'll open June 1st. You do a model based on April 12th. I think that's a ridiculous model, but anybody can come up with a model that they think is appropriate. We could project revenues, and we could try to project expenses, and then we could be made to look foolish once circumstances on the ground are different. So I think the way to look at this is this bill just passed. We don't know the circumstances of how the money is going to be given out. I assume they're not just going to hand us cash. They're going to ask, we're going to file, and we're going to have to show documents. We're going to have to show specific amounts of money spent. We can certainly show a host of different things as a county government that we've spent on. And as long as we know that some of that money is going to go for individuals, some of that money is going to go for businesses, some of that money is going to go for hospitals, then we certainly appreciate that portion of it, which is going to go to the county government to help us have stability as well. Without that assistance from the federal government, I don't believe the state government, the county government, the local governments will be solvent. I do not believe that businesses will be solvent, and certainly individual human families will not be solvent. This is a moment analogous to 1933. I wasn't alive in 1933. I read stories about what happened. We've been through 3 or 4 years of the Depression, and then and the philosophy of the federal government prior to 1933 was, we'll do a little bit on the margins, but you're basically on your own. A different philosophy came into play with Franklin Roosevelt, and he said that we as a federal government have responsibility to help these local governments. We're not going to fall back on, well, that's not our job, that's the state's job. We're going to step forward. And if this is the first process of stepping forward, then that's important. And I would say to people, I know people outside Westchester aren't watching this. I doubt all that many people in Westchester are going to watch this. But I would say to people elsewhere in the country, if you think that you're giving New York a bailout, number one, just remember that New Yorkers supported the money necessary to rebuild New Orleans and Louisiana after Hurricane Katrina. After Hurricane Harvey cut a swath through Texas, New Yorkers were prepared to support that. And when the hurricane devastated Puerto Rico, that New Yorkers were prepared to support that. New Yorkers were prepared to support California's response to the wildfires. So we New Yorkers have always been ready to stand up and help our brothers and sisters around the country. And if we are in the most impacted area, then we would look for similar assistance as happens around the country. Secondly, I don't think this is New York specific. It may be New York right now, but I think in due time we're going to see this disaster come to the shores and the front doors all across this country. And I will be willing to support what has to happen in Kansas and Colorado and Nevada. I'm not going to care what's a red state. I'm not going to care what's a blue state. They're red, white, and blue Americans that need help, and we should help them. But we should not be prejudiced against as New York State because we were first. And I think that's the concern that I have as this money is being allocated.
Okay. Another question from Peter. Governor Cuomo said this morning that the rate of increase in cases in Westchester has slowed. Do you have facts to show this?
I think that is something we'll want to look at because in parts of Westchester it has slowed. Certainly we've made the reference in New Rochelle. There was a great spike early on. It has not grown by that percentage forward. Smaller communities that had 2 or 3 cases that are now at 10 or 12 cases, the percentage of growth is much higher, but in absolute numbers they haven't been as dramatic. We have grown because we have tested more people. But not only do we have more positives, we have more negatives, and the number of negatives off of testing far exceed the number of positives. But I'd be happy to talk to Peter in a one-on-one conversation to give some more depth to that answer.
Okay, next question comes from Mark at the Journal News. I'm going to read it exactly. A lot of municipal governments have seen increased absenteeism or employees calling out sick in the face of the outbreak. What is the county seeing with staff, and are there concerns with keeping up with the level of its essential staff, specifically in the police department and jail?
Well, under leadership of Joan McDonald, who's our Director of Operations, and she's consulted with Ken Jenkins, our Deputy County Executive, or other senior managers, we put a plan together to identify those that could work at home, so we would voluntarily reduce the amount of staff that comes into our various offices, not just here in our White Plains County office building, but elsewhere. In the process of doing that, we built into the fact that people are afraid, and they're afraid that they're going to come in contact with the virus just by going to work on a normal day. And so for as many of those people as we can, we have given them the opportunity to work from home. Now, obviously, the nature of your job depends on whether you can work from home. We cannot have people work from home and run a jail or run a sewer treatment system. On the other hand, in our budget, finance, information technology, law departments, planning departments, we have basically the kind of functions that can be done by people on their laptop, on the telephone at home. We've tried to do that. To the greatest extent possible, the municipal officials, I think, are doing the same thing. But yes, there are call-ins. There are people, and particularly those in some of the public contact positions that are concerned. I'm not going to criticize individuals. They each have to make up their own decisions. But I will tell you this. Those of us who choose a life in public service are often criticized dramatically. We're thought to be people, we don't work hard, we don't have the skill set that it takes to succeed in the private sector, we have these gold-plated benefits, and somebody's watching this out there going, yeah, that's exactly right. Well, they're exactly wrong. I've spent time in public service and I've spent time in the private sector. In the private sector, I did not have job security, but I also had much greater compensation. And I had compensation that tracked how hard I worked and what I produced. In this government, in the public sector, you can produce a high level of work, but there's no bonuses. There's no additional compensation. If you work harder and you produce more, you do it because it's important to you to do it. And the job security factor matters to some people, but not to other people. For some people, it's the sense of achievement in doing something for others. And you see that when you look at those nurses. We saw them identified in some of the public media outlets. They go above and beyond and put themselves in the middle between them and contagion because they want to do their job well. And we have that not just in our first responders, not just in our correction officers, but we have that kind of commitment throughout this government. And I will tell you, the last 2 nights, I have participated in village and town board meetings and city council meetings by phone, by hookup, with 12 different communities. And every one of those communities, from Peekskill to Pelham Village, have had individuals in their workforce that they have complimented for their hard work. So there are individuals that call in sick. There are individuals that are scared, and who am I to say what you should be afraid of or not? I can tell you this, though. I ran for this office. It's a little bit different than being appointed to it. And I know that my time in this office is limited. I'm not going to be 35 years and get a gold watch at the end of it. But I realize that every one of us in public office have made a commitment to serve the public. If you don't believe in serving the public, you're in the wrong business. There are jobs out there when this economy gets stronger where you don't have to worry about serving the public, just serve the corporate entity. I served in those organizations myself, and you can make your money, and as soon as you're finished at the end of the day, you go home at night, you spend your time with your family, you take your vacations, you live your life, you retire when you're able to do it, and you live your post-work life. But in public office, and the public office applies to people who are appointed to office and serve in civil service jobs, as well as it does to elected officials, you have made a commitment to something more than yourself. And I would hope that every person who has a public job, a public position, would stand up for that standard. I certainly believe that's true of the people that I brought into government, and frankly, the people that I've kept in government that I inherited when I walked in this job.
Okay, last question also comes from Mark. How unlikely would you say it is that playland and county pools open on time or at all in 2020?
Well, the decision to open them at all is yet to be made. I think we have to see where we are in the bell curve that we've talked about, the surge, if you will. We have not seen the front end of the surge yet, so we don't know how high it's going to be, how long it's going to last. We certainly have to make a decision in the next 10 days about whether or not we open Playland on time, which would be mid-May. It is more likely than not that if we open Playland, we'll open it later. The first fallback date would probably be Memorial Day weekend, and for that we would then buy ourselves another couple of weeks to make a decision. The public beaches would open on Memorial Day weekend, and so therefore we have the vicinity of about another 3 or so, 4 weeks maybe, before making that decision. The pools will open in June at the end of what would normally be the academic year, and we probably buy ourselves another month more than that, about 2 months from now, to make a decision on the pools. But, you know, when I answered the question about golf and I talked about our parks where there is social distancing, there's no social distancing at a pool. There's no social distancing at Playland. There's no social distancing on a beach. So we open them up only if we know that we can be in that kind of close quarters and enjoy the time together. I have faith that we could turn Playland around. I've staked, my belief in that very publicly and very clearly. I have put my stake in trying to fix parts of the park system that needed fixing, the rebuilding of the Miller House Washington headquarters, the reopening of the Sprain Ridge pools, both of which are now open and operative. It pains me as much as anybody to think that I won't open Playland this year. It pains me as much as anybody to think that I won't open those pools this year. I was a poor kid from Mount Vernon that understood what a public pool meant because I wasn't a country club kid. I couldn't go to the club. I couldn't go to the private beach that my father had access to. My father was a maintenance man. My mom worked in a factory, and I walked across town to Wilson Woods Pool in Mount Vernon. That's how I cooled off in the summertime. And there are kids just like me today. And I don't want to deny them that opportunity. But if the trade-off is health, if the trade-off is potentially death, at least for some people, maybe not the young ones amongst us, then I can't make that trade-off. So we'll try to do the best we can. And whatever decisions you make in the line of work that I'm in, you're held accountable. I know that when this tape is over, people will comment on social media. Some will be critical. Some can be always critical. You know, I'm in the wrong political party for their taste. Some people will be complimentary. 3 weeks from now, some people who are complimentary today may be negative then. And at some point in time, if I choose to run for re-election, everybody will have a referendum on whether they think I've done a good job or not. But whether the public at the end of the day thinks I've done a good job, I have to believe in my own heart that we're making the right decisions. And when I keep open the golf course right now, but I talk about the potential that we may not open a pool, it's based on judgment. And that judgment will ultimately be determined to be right or wrong by the people of Westchester County, and I will live with their ultimate judgment at some point in time. Thank you very much. Have a good day. Please be safe.